Before we start, we acknowledge the traditional custodians of the land that we propose the research to be conducted and recognise the strength, resilience and capacity of the people of this land. The research question I propose is overcoming Aboriginal health disadvantage, and this is by improving patient attendance and reducing discharge against medical advice in Western Australia, otherwise known as DAMA. This study aims to provide value-added evidence that can be utilised by the WA health system and will add to the historical evidence of increased levels of DAMA that have been seen in the Aboriginal population. It's intended that this research will offer identified mechanisms to reduce the levels of DAMA occurrence, allowing a focused awareness for clinicians, health teams and organisations to provide a culturally safe environment that may reduce DAMA incidents in the future. As part of the hypothesis, the constructs to this study highlight the following hypothesis key points. Firstly, if the cultural safety for Aboriginal patients is not managed, Aboriginal patients will be less likely to seek healthcare and/or remain in the health system care setting, leading to an increased rate of DAMA. Secondly, clinician experience and ability when working with Aboriginal patients will directly influence the relationship between the doctor and patient. Therefore, as with cultural safety overall, Aboriginal patients will most likely DAMA if the clinician is not aware and sensitive to the Aboriginal patient's circumstances. Improved methods to offer culturally safe clinical experience are clearly benchmarked by the recent Katherine Hospital changes that saw a decrease in the Aboriginal and Torres Strait Islander patients discharging against medical advice. Qualitative research will form an inquiry that analyses information conveyed via language and behaviour in a natural setting and allows the study to learn directly from the patients what's important to them. The survey will be undertaken in part by both completed survey forms and interview process, including consistent variables in either scenario. A grounded theory study is expected to develop with the themes emerging from the survey data, and I envisage that these themes will develop and assist in identifying what is actually occurring in the sphere of DAMA rates for Aboriginal patients in Western Australia.